Spread of a highly drug-resistant fungus called Candida auris is sparking caution in concerned areas of the U.S. This map from the Centers for Disease Control and Prevention shows the number of clinical cases as of February 28th. Only one case has been reported in Indiana, but across the state line, there have been 144 cases in Illinois, mostly in the Chicago area. Nicole Christine spoke to a local health professional about the risk of the fungus affecting people in Terre Haute. She joins us now with more. Nicole.
Mike, anytime a superbug or fungus begins popping up in the Midwest, Valley residents have some cause for concern. But this particular pathogen acts in typical ways, and while it is deadly, health officials say locals don't need to be on high alert. When searching for the breeding grounds of Candida auris, health professionals point to typical areas.
Warm, dark, and wet climates.
And Mark Kyleman says locals shouldn't fear finding the fungus in their everyday environment, for it mostly affects those with already lowered immune systems.
It's not something that's walking up and down the streets, downtown, etc. So yeah, it would be the sicker population that are a little bit more susceptible.
As with any pathogen, the best way to prevent the spread is through simple hygienic practices.
We really treat it no differently. So your standard precautions, remaining vigilant with hand hygiene, with guard protection depending on the patient, what type of infection it is, whether it's a wound, a pneumonia, whatever the case may be.
Kyleman adds that there have been 0 cases of Candida auris reported in Vigo County, and locals can trust that health officials at every level are on alert of the existence of this deadly fungus.
With something like this for us, it's more of an FYI. At this point, we don't change anything because it hasn't gotten here, and we feel like we already have sort of the standard precautions in play to help that. But we do track it, and we have the state in our corner helping us out as well.
The Illinois State Department of Health released some tips on hand hygiene that suggest patients and loved ones hold themselves, as well as the health professionals they interact with, accountable for remaining vigilant with thorough and frequent hand and equipment washing. Mike.
All right, thank you, Nicole, for that report. Mark Kielman shared some of the typical signs and symptoms of Candida auris. He says fever, nausea, and fatigue are some of the main symptoms. Also, respiratory problems could indicate the presence of this in the lungs. He adds the fungi take longer to grow than bacteria, so the symptoms may manifest over a longer period of time.